New study shows giving cash to the poor is the best way to help someone break the cycle of poverty.
Tonight in our original series, Project Home, Susie Steimle looks at the research carried out in rural Kenya that could be applied to the Bay Area.
It's a decision you've likely been faced with before. Do you give someone in need cash? Can you trust them to spend it wisely? Researchers at UC Berkeley looked at those questions on a larger scale and came back with a resounding yes.
In our case, trusting the poor to spend money on what was best for them seemed to work very well.
Ted Miguel is an economics professor at UC Berkeley who has been visiting rural Kenya for 2 decades now. During his most recent trip, his team gave poor Kenyans $1,000 in cash and saw a stimulus.
There's been a fear that by providing cash, you'd be giving money to poor households that would spend it in unwise ways, that they would buy alcohol or drugs or gamble it away. We didn't find any evidence of that.
Miguel said most Kenyans spent the money on food, home improvements, and education for their children. Every dollar spent grew 2.5 times in the local economy. To him, it's a message that we need to be more trusting of the poor and that we should explore the concept of universal basic income, an idea popularized most recently by presidential candidate Andrew Yang. Yang gave $1,000 in cash to families on the edge and found it made a big difference.
Relatively small amounts of cash can help households that are really on the edge of subsistence avoid very painful choices. It can, avoid setting off cycles of poverty.
Studies show 57% of U.S. families don't have enough cash to cover a $500 unexpected expense. So in the Bay Area, where the margin of error is so small, families can easily lose their footing because of a car crash, parking ticket, or health scare.
That is something that in the richest society in human history, which is what the United States is really unacceptable.
Rural Kenya, of course, is a far cry from life here. And Miguel says when it comes to giving the homeless cash aid, our population does have more mental health and substance abuse issues that are not paralleled in the developing world.
For a homeless population in the Bay Area where there is a very high level of mental health problems, substance abuse, maybe the best thing to do would be to combine cash with assistance, but it could be that cash is part of the solution.
For Miguel, the study found a simple truth. This cash infusion in Kenya helped everyone, and it might be able to help people here, too.
Transferring money to the poor doesn't just benefit the recipients, but can benefit the whole local economy.
Next, Miguel and his team plan to study just how far this ripple effect goes. The people that they helped 18 months ago are better off than when the study started. And if that continues, Miguel says it's proof of a poverty gap that can be closed with cash. Susie Steimle, KPIX 5.
We want you to keep sending your stories and ideas to Project Home at CBS.com and see all of Susie's reporting on our website.